Dr. Miller here. So, we're going to continue our insulin discussion since you've clicked and followed through. And so, let's review real quick optimal numbers. Optimal numbers by consensus is fasting insulin should be between 3 and 4, definitely less than 10. You're starting to get into trouble when your insulin is actually at a 6, especially fasting insulin at a 6 is yellow. You're starting to have problems. You're probably getting insulin resistant. If everything seems to be fine, but yet you can't lose weight and you're having problems, you should probably take your insulin 1 hour postprandial, which means after a meal, and then 2 hours postprandial. That way you start to see why or how the body is dealing with this and coming back to a baseline. Because if you watch an insulin spike or a blood sugar spike after you eat, what you will see is at 30 minutes it should reach its peak and then it should start to come back down to a baseline. So what happens if insulin goes high? Well, insulin shoves blood sugar into the cell. So if your insulin goes high, your glucose goes low, unless insulin has been high for a very, very long time. And then you start to get into insulin resistance. And we'll go over that in just a moment. But just acutely, you get an insulin spike, glucose goes low. If you notice that about an hour after you eat, you start to get hungry. High insulin will increase anxiety. Long-term high insulin can cause acanthosis nigrans. So if you look at somebody's skin folds in the arm, back of their neck, they'll have what is called acanthosis nigrans. And that means it looks like their arm is dirty, or it looks like the back of their neck is dirty, or under their arm is dirty. And that means that they've actually had high insulin for a long time and it's changed the pigment in the skin. Next thing you start to see is the coma and seizures. If insulin goes high and stays high and drives blood sugar down very, very low, the next thing that happens to you is you go into a diabetic coma. Also, acne breakouts and frequent urination. And these are all for insulin that is acutely high. Now, let's say that you've had high insulin for a very, very long time. Well, high insulin, let me just take a moment here to say, we're not really going over low insulin because if you have low insulin, you've probably had it for all of your life and you're probably what they call a type 1 diabetic, and that's an autoimmune disease. So now, chronic high insulin is known as insulin resistance. And here are the signs and symptoms of it: weight gain, headaches, skin tags, vaginal infections, UTIs, skin infections, acanthosis nigrans again, slow cuts, slow healing cuts and sores. Once it goes for so long, the cell starts to get, let me see where my cell is. I'm going to disappear for a second. So once the cell itself starts to have blood sugar that is there for a long, long time and high, the body wants to start to block that out. It doesn't listen. The receptors aren't as responsive. And that's called insulin resistance. And so once somebody starts to get that insulin resistant for a long time, the cell is packed with sugar. It can't take any more. So now the serum starts to have excess sugar in it, and that causes a problem. And that's when somebody is considered diabetic. Next is excessive thirst, excessive hunger, frequent urination, high blood pressure, blurred vision, and high triglycerides. I want you to think about if you have high triglycerides, high blood pressure, excessive urination, start to think about this high insulin level. And most people at that point in time are also have excessive weight, unless they're really, really active. And then that's pretty much all due to a really crappy diet or they drink a lot, typically. The next for insulin resistance, hormonal issues. And this goes from PCOS all the way to low testosterone and estrogen imbalances. And I really want you to start to think about how this newest generation, I'm 54 now, my time to have children is over. So for my children, they're getting to that age. And in our practice, we see more and more women that come in that look like they should be able to conceive and carry and have no issues. But once we start to really dig into the numbers, it's amazing to me that these women that come in that can't conceive and carry, that are normal, healthy looking, cannot conceive and carry. That's a problem. And so when we look at these problems and we start to do our basic blood work, we usually see that insulin is high and it throws a lot of stuff off. When I used to actively do CrossFit, there were so many women in there with PCOS that didn't know it. It was unbelievable, and high insulin levels. And they would look at me and I would talk about this like I was crazy. But now I've had enough success with helping women get pregnant, conceive, and carry that we know that this is absolutely true. My wife has seen this over and over again, and it's the first thing she talks about. So other symptoms of insulin resistance, the reason why I harp on pregnancy, I, I love children. I love family. I think that's a big problem with what we have in America. We have a loss of family and family values. And so I'd like to see that come back. And those people that want to have children, and you're having a problem, this is a very simple and easy metric to look at to help you achieve your goal. Craving sweets, belly fat, fatty liver, and gout. These are all problems with insulin resistance. And it's a problem with insulin resistance because when insulin stays high, insulin is the hormone that towards fall and beginning of winter goes high in animals because they're eating berries and they're getting that fructose in, and that fructose turns off the check valve for the insulin. So now they can pack on weight because insulin is your fat packing hormone. Gout, with gout, the insulin causes issues with uric acid going up. And so if I can ever say one thing, I know in these blood studies, we're actually just going over one metric, but you can't separate these metrics. Your body is a system and it's meant to work together. So that's what happens. And when you throw one off, you don't throw off one thing, you throw off a bunch of things. But the body can only really give you symptoms, simple symptoms, rather than saying, oh, hey, here it is. And genetically, what are you predisposed to? So that's another way that the body expresses its issues. With that being said, hey, if you need to contact us and you need help or you want to know what your insulin levels are, reach out. Integrated Health of Indiana. We are happy to help you. We love and celebrate when our patients get pregnant. And so far, knock wood, we're at 100% with that. Thank you. You have a wonderful day, and we'll see you in the next one.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.